And now, here's Steve Klein.
And we're back. We're going to have a individual that has developed a new kind of way to take care of patients. His name is Dr. James Pinckney. He's the founder and CEO of Diamond Physicians, located in Dallas and now in Frisco. Dr. James opened his concierge medical practice in 2012 with a mission to improve the client's experience by focusing on the patient-physician relationship. Diamond is a leader in affordable concierge medicine, also known as direct medicine, in which clients are guaranteed access to health care 24 hours a day. Dr. James is among a growing number of doctors who no longer accept insurance due to increased costs. Instead, his practice charges clients a monthly fee for unlimited visits and procedures with no copay. This healthcare model has gained momentum in response to waste and frustrations with healthcare delivery systems. In the past year alone, his patient numbers have tripled. We're going to hear about that. Dr. James, welcome to Playmakers Talk Show.
Thanks for having me on the show.
Well, this is an interesting concept. How did you actually create Diamond Physicians?
That's a great question, Steve. It started back in 2009 when I was a surgery resident at Cedars-Sinai in L.A. I was still trying to figure out where I wanted to go in my medical career, and it's a celebrity hospital, so I got my first taste of concierge medicine at Cedars. I thought it was an amazing concept, but I said, you know what, how can I make this available for everyone and not just the super elite?
And that's how it started. So how did you end up from the West Coast back to Dallas?
Well, I decided that I needed to transition from surgery to family medicine. So I applied for residency programs in Dallas. I'm originally from Dallas, from Plano actually, grew up in Plano. And I got into Methodist, and then I finished my family medicine training. And then I went out and polled concierge doctors all over the country. And now that was in 2012, and the financial markets were tight. I was pitching my business plan. A lot of concierge doctors thought I was absolutely insane. They said, you can't charge a monthly membership fee. You've got to charge an annual fee. And I said, I understand cash flow, but who can afford $3,000, $4,000, $5,000 a year versus $150 a month? So that was my premise. That was the model. I knew it would work, but I had to go out and acquire financing, which was very challenging. 11 banks told me no. And then the same day, 2 banks told me yes, and it was the same day I met my wife.
Interesting how that actually happens.
Great day.
The great things happen. But something else I just pulled from that. People told you were insane. 11 banks told you no. And in working with successful people, I find that is what has to happen for it to be the right business. The fact that they told you were insane, it was the right business because they weren't willing to do that. Well, direct medicine is what you call it, not necessarily concierge medicine. Talk about your model, because you're a little bit different than all other models out there. How is yours different?
Right. Well, it's a brand new healthcare delivery model, and we focus on the patient-physician relationship. So it's membership medicine. Our clients pay a monthly membership fee. For the cost of a cup of coffee a day, they receive unlimited visits, no copay, 24-hour access to their doctor. They have my cell phone number. They can email me. We can Skype, FaceTime. They also receive unlimited visits, and plus unlimited urgent care, which is a huge piece. So all your acute services are included. So you pay one low monthly fee. Kids start at $45 a month, and you receive all these incredible services.
We were talking before the show started about a woman that came to ER where you also do some work, and that procedure for her child was $1,800. And how much would it have been if she was coming to you?
It would have been included. It would have been $45 a month, no additional charge. And unfortunately, that's happening at ERs all across the country. We've got to figure out a way to curb healthcare spending. We spend 17% of our GDP on healthcare, more than any other industrialized nation. It's rising at twice the rate of inflation. So if this continues, unfortunately, our country will go bankrupt.
So essentially, as we talked about before, you are self-insuring at the low end, paying for the day-to-day type medical problems, but then you have your insurance, and that takes care of any catastrophe that happens.
Right, and that's how health insurance should be used. It should be used like your car insurance or your home insurance. Steve, when you fill up your car with gas, you swipe a credit card. You pay cash. When you need new windshield wipers, when you need an oil change, your tires rotated.
You don't call the insurance agency.
No. Your insurance premiums would go through the roof. When you get in a car accident and you have thousands of dollars worth of damage, that's when you file an insurance claim. That's how insurance should be used. It's a risk mitigation tool. Health insurance should be utilized the same way. And if we can get back to the catastrophic piece, as we were in the 60s and the 70s, before the rise of managed care, which was around the early 80s and then exploded in the 90s, we can start reducing healthcare costs and introduce price transparency into the marketplace.
We're talking to Dr. James. He is the CEO of Diamond Physicians. You can find him at diamondphysicians.com. With all that, how is your model profitable?
Oh, it's extremely profitable. Our physicians make 3 times the average family medicine salary, and it's because we reduce the number of clients that we see. So we charge around about $145 a month overall, and we have 600 clients per doctor. Now, we also have other ancillary services that we offer. We have an advanced physical exam, the best physical, in my opinion, on the planet. It's a heart attack and stroke prevention program called our Diamond 360 Executive Physical. That's another one of our revenue drivers. And then our third revenue driver is geared towards corporations. So we save corporations 25 to 35% off their bottom line healthcare expenditures. It's amazing. It doesn't matter if your company has 2 employees or 1,000. We can handle your business and make sure that you're putting your healthcare costs in the right buckets, because we negotiate wholesale rates and deliver those savings directly to our clients.
You can find Diamond Corporate and Diamond 360 on diamondphysicians.com. My take on this is what you're doing, it's almost 100% preventable medicine. You're doing the things to make sure people don't have to come to you.
That's exactly right. We are being proactive. The current medical system is reactive. If you're not sick, you don't go to the doctor. That is the wrong way of thinking. And the doctor and the patient are not aligned. So if the current physician in the insurance model, if you don't come in, they can't bill for that visit. Our model is the exact opposite. The patient and the physician are aligned, and we're incentivized, because if I don't run my practice efficiently and all my clients are calling me 24 hours a day, well, my model, it will break. It's like a gym membership. But if I'm doing a great job, I'm practicing wonderful medicine, I'm taking care of my clients, then they don't call me as much. So I want you to be healthy. I'm incentivized to make sure that you're not subjecting yourself to all the lifestyle rigors that the typical Americans have to face.
In reading about health and medicine, I know there's a lot of people that don't go to doctors because they're afraid of what they may find out. Matter of fact, men are probably the worst at this. They just will not go to the physician. But what you're doing now is opening it all up so that anybody can come to you anytime for any type of question. And as I mentioned at the break, you're almost like the old-time doctors that made house calls. In essence, you're doing that with Skype or just the conversations you're having with your patients.
Exactly right. We're reinvigorating the patient-physician relationship, which is the most important thing. The average face-to-face time with your doctor is 8 minutes across the country. The average face-to-face time with a Diamond physician is 60 minutes.
So you're spending time with them, finding out where they are at that moment. There was a question I had, and you really answered it, but let's see if you have any more to add to it. Why do you believe Diamond Physicians is the future of healthcare in the United States?
Managed care has caused an exponential growth rate in the price of healthcare. Networks are shrinking. You can't get in to see a physician. The specialist wait is now 90 days, and healthcare prices are rising through the roof. So the only way to reverse all this is to cut managed care out of the picture. And like I used the car insurance analogy or your home insurance, use health insurance for the catastrophic piece. If you need a surgery, if you get in a car accident and you have a $100,000 hospital bill, that's when health insurance should kick in. For all the healthcare risk below your deductible, that should be managed with your primary care physician, and you should pay cash. Health insurance should not be used for the routine maintenance of health. It's too expensive.
And that's why you are the future of what's going on. Well, you now have an office in Frisco in addition to Dallas. What are your plans for expansion? How large can Diamond Physicians become?
Well, Steve, we're actually the first concierge practice in the country to implement the franchise model. So we are franchising. We are launching a national franchise initiative actually in 2 weeks. And we're looking for physicians and investors who want to join the direct primary care movement and call us at 214-395-3491. You can go to the website at diamondphysicians.com. You can email me at franchise@diamondphysicians. So investors, physicians, we want to blanket the country with truly affordable health care.
So on diamondphysicians.com, if you're a potential patient, you can find out all about it. If you are a doctor, would like to look at a new model, you can do that too. You are also looking at something else that you want to do. You want to begin to put back, and I think it's called Shine Bright. Talk about what Shine Bright is going to be.
Yeah, Shine Bright is our nonprofit organization that we're forming, and basically, instead of charging $45 up to $200 a month, we'll be charging somewhere in the range of $20 to $100. So it's really for that low socioeconomic platform that they deserve the best care but just can't afford it. So Shine Bright is really geared towards that lower socioeconomic platform and having a Diamond Physicians in those pockets in our society.
Now, that has not started yet. When do you foresee that happening?
Well, we're doing some fundraising right now. Again, we're looking for investors. So as soon as we can put together some funds to employ that model, we're looking at some locations in South Dallas. That's where I trained at Methodist Charlton, so it's very dear to my heart. I worked with the underserved for 3 years, and that's really where Shine Bright, that's where it originated from, was that desire to really give back.
Well, I was impressed, we were talking earlier, that you also do a rotation with ER medicine, too. As I said before, it keeps you honest. It keeps you with those patients. Why else do you do that? Why are you also going through that rotation?
Well, remember now, I started out as a general surgery resident, so I love kind of the trauma and doing procedures and sewing up lacerations. And unfortunately, in primary care, it's a little bit slower paced. And I love talking to my clients as well, but I don't want to lose those skills. So I enjoy doing ER rotations. I still do one shift a week to keep the skills sharp and to stay connected with the underserved, really.
And it obviously gets you to do that. One more time before we finish, I'm going to ask you about your website again, but tell everybody one more time what they're getting by doing business with Diamond Physicians that they're not getting from a normal physician.
Well, you get to see your doctor. You get to call your doctor.
That's a big one right there.
And cultivate that patient-physician relationship. And again, it's 24-hour access. And I know it sounds too good to be true, but for the cost of a cup of latte a day, you can actually have your own concierge doctor that previously cost $5,000, $10,000, sometimes $40,000 a year. So a fraction of the price, all the services, and better care at a better price.
So I can call you as much as I want,
anytime
for any type of issue.
That's right.
That's amazing. Tell everybody where that website is again.
DiamondPhysicians.com. You can email info@DiamondPhysicians.com for general questions. And if you're interested in a franchise at DiamondPhysicians.com.
As I thought about one more question, how many physicians do you actually have at your two locations?
We have 3 physicians total right now, but we are expanding. We're looking at an uptown location here in early 2016. We have investors in demand all over the country. So we're just really finishing our franchise disclosure documents so we can launch our initiative. And I've got an investor actually that may purchase 6 to 8 units. So we're looking to expand quickly because the demand is just so high.
Get on it now. Diamond Physicians will be large. Dr. James, thank you very much for being a part of Playmakers Talk Show.
I really appreciate you having me on the show.
Dr. James Pinckney is a founder and CEO of Diamond Physicians. And again, you can go to diamondphysicians.com to find all about direct medicine or concierge medicine. This has been a fantastic show. Thank you very much for listening. Join us at playmakerstalkshow.com where you can get all of our replays and past episodes. That's playmakerstalkshow.com, and we're going to be back next week with more Playmakers. See you then.
You've been listening to Playmakers with Steve Klein. Join him again next Friday at 3 p.m. for another sit-down with DFW's most interesting Playmakers.